Hello, I am Kirk Rigger. It has been my privilege for the last 2 years to serve with my wife, Dr. Karen Meyer, as co-chairs of the Charity Open. Our role has been to broaden the awareness of giving to the Agnesian HealthCare Foundation and be leaders of this philanthropic movement. The sky is the limit as to what we can accomplish through personal and professional networking. Increasing the visibility of the Foundation's good work with regard to the end-of-life care needs and how Agnesian HealthCare ensures these services are available to all who need them.
I'm Dr. Karen Meyer. As a provider, I see patients from all walks of life and all conditions of health. I see firsthand the need for palliative and end-of-life care. Many families don't address this until they are in the middle of the decision-making process. They are not even aware of the cost, but they're also not aware of all the services that are available to them through hospice. Hospice can ease their fears and provide comfort. Attending physicians, medical directors, hospice nurses, hospice social workers, volunteers, home health aides, and spiritual and bereavement care all come together to ensure that patient and family needs are met. This all comes at a cost.
All funds raised through Charity Open 2016, The Sky is the Limit, will support direct hospice patient care expenses. I am Alicia Steffes, and I'm beginning my 2 years of service with my husband, Dr. Bert Steffes, as Charity Open chairs. As a junior co-chair and not a doctor, I have quickly learned how large the need for hospice care is. Currently, we have 12 beds occupied at the Hospice Home of Hope. Additionally, we are serving 118 patients in their home. More than 200 patients are served every 3 months. The cost of care at the Hospice Home of Hope is just under $300 per patient per day. Patients on average are served for 72 days, and 25% of our patients are in care for less than 1 week. More than 250 volunteers give a combined 14,000 hours of their time to serve patients and families in hospice every year. Hospice has a staff of over 100 qualified professional employees, and about half of Hospice Home of Hope patients receive financial assistance. All in all, it takes just about $7 million annually to offer hospice service to our community.
I'm Tara Rhodes, and my mother-in-law, Julie, has been in hospice since end of June. Julie has end-stage COPD, and as a family, we decided, with her blessings, of course, that we're going to come here so she can have care 24/7. It really became apparent independent living was not an option. She wanted nursing care. Daily, the caregivers come in, make sure Julie's comfortable. Hospice isn't about medication and meals, it's about comfort measures, and that's exactly what hospice does. Our family has peace of mind that Julie's being cared for by professionals who do this every day. It's such a blessing because when we come here, we can just be together and be a family because we know that all of her cares are being taken care of. The sky is the limit as to what hospice will do for Julie and our family.
My name is Julie Rhodes. I'm from Waupun. I have 5 grandchildren. Worked at Oscar Mayer for 8 years, and then I went to Datex Omeda, where I worked for 11 years and retired from there at 62. I smoked for probably 40, 50 years, which led me to emphysema. My disease has progressed where I can't function for myself. So the next best thing, hospice. When my kids come, we go in the room, otherwise we go outside sometimes. Grounds are fabulous. You have no wanting needs in here. For end-of-life care, I'm glad hospice is an option. I'm peacefully living my life as long as it goes on with my family.
What would you give to ensure your mom, dad, sister, brother, loved one, or friend receive the best care possible at the end of their life? To feel comfortable, loved, cherished, to live their last days knowing their life was valuable. Is the sky the limit? Hospice needs are increasing, and meeting these needs is within our reach. Will you help? Will you help ensure that this care continues to be available for all who need it? Hospice is not a place where you count the days. It's a place where the days count.